Sure. So I work for a company called Varian Medical Systems. We're a US company founded all the way back in 1955 on the Stanford campus in California. Now a worldwide organization solely focused on cancer therapy and particularly in the field of radiation oncology. So we're the largest supplier of cancer therapy systems worldwide. Probably better known for the supply of linear accelerators, which are designed for treating cancer with radiation oncology. More recently in the field of proton therapy, which is a new form of delivering high dose but highly precise radiation oncology. In fact, we're installing our systems right now in the Christie Hospital in Manchester and in UCH in London, so the two national proton centres will be within the UK. Installed one clinical in 2018 and the other one due to be clinical in 2019. Although we sell a lot of radiation oncology equipment, we also have a large software and technology part of our business. It accounts for around 20% of our global turnover, and all of that technology is focused on supporting patients receive better cancer treatment within and throughout their cancer journey. We are very highly clinically focused within our software platform, so very much involved in managing the patient from a day-to-day perspective, whether that be from a purely patient management perspective, but all of the way to designing software solutions that actually result in them receiving better clinical service. So whether that be treatment planning, which is the highly complex process of defining what our machines are going to deliver in terms of treatment planning, all the way through to our latest technology, which is highly focused on providing better clinical insights for clinicians to act upon the wealth of data that we have to help them make better decisions at the point of care with their patients. So rapid learning, using prior knowledge to apply that, to give that into the hands of our clinicians to make better use of that data in their day-to-day decisions for their patients. In our experience, I think for the last 20-30 years where healthcare IT has been around, that's very much been focused on a volume-based approach to delivering healthcare, but we're now transitioning much more to a value-based healthcare model where we're focusing far more on clinical outcomes, long-term better quality of life for our patients, which are actually much more difficult things to measure in terms of the efficacy of a particular health IT system. So one of the big challenges we see is how the NHS is going to adapt the way it procures and consumes technology and actually measure how that actually delivers better outcomes for the patient. I think our experience today is that, to quote one example, that the procurement models and the approach to consuming health IT is not yet quite aligned with the actual value-based sort of healthcare model that we're trying to develop. I think one of the most significant developments will be harnessing the huge volume of data that exists out there in the field of health IT, and actually using very latest technologies such as rapid learning, knowledge-based models to provide better decisions at the point of care for the patient. So I would say knowledge and rapid learning are probably the two biggest areas of development we will see in health IT. I think events like this are particularly important because it brings together people from different fields. So you have industry coming together with clinicians, with CIOs, with CTOs, and just bringing those people together for a day away from the pressures of everyday life so that we can really engage together and talk about these big issues is probably the biggest value that we have. So the opportunity to network, to talk and share each other's challenges and problems and come up with better ideas.